The next person we have to testify before us is Joshua Dankoff, Director of Strategic Initiatives for Citizens for Juvenile Justice. Mr. Dankoff. Handouts, I guess. Good morning.
Good morning.
Thanks for coming before the committee.
Thank you so much. Chair Day, Chair Eldridge, members of the Judiciary Committee, thank you for the opportunity to testify. My name is Joshua Dankoff, Director of Strategic Initiatives at Citizens for Juvenile Justice, an organization established 28 years ago to advocate for statewide systemic reform that achieves equitable youth justice. I want to invite you to imagine that your own adolescent child has an identified disability. That is, they have an IEP in place and receive special education services at school. Now, if that child is 17 years and 360 days old and is accused of breaking the law, they may spend time at the Department of Youth Services, DYS, and they will continue to go to school 5.5 hours a day and broadly receive special education services in line with their IEP. However, a few days older, if that child is 18 years old, accused of wrongdoing, they may spend time at the House of Corrections or Department of Corrections. And as my testimony will show today, their educational rights will almost certainly be denied. In August of this year, CfJJ published a report entitled Schools Out, Massachusetts Youth in Adult Correctional Institutions Denied Education, which focuses on older adolescents in the adult carceral system. This report is available at cfjj.org/schools-out, and the executive summary is provided as an addendum to this testimony. Federal law dictates that for students with an identified disability, their right to receive a free and appropriate public education continues until the student reaches their 22nd birthday or they receive a high school diploma. Sadly, the primary finding in Schools Out is that our state systems do not fulfill the educational rights of young people age 18 to 21 who have an identified disability and who find themselves incarcerated either at the Department of Corrections or one of the houses of corrections. Indeed, the number of these youth who receive special education services is appallingly low. At DOC, in response to a public records request, they shared that only 2 young people received special educational services over a 2.5-year period leading up to 2021. 2 in 2.5 years. This is a tiny percentage of the young people in DOC's care, 18 to 21, and really represents a failure of multiple system actors to identify and provide young people the educational services to which they're entitled. At the House of Correction level, in September 2022, an average of only 16 youth were receiving special education services across the entire state. This represents less than 10% of the youth in House of Correction custody of that age group, and half of the House of Corrections have no special education students identified. And to give one example, Norfolk House of Corrections has not provided special education to any student in more than 3 years. Based on what we see at the Department of Youth Services, where just over 50% of youth in custody have an IEP, the House of Corrections are also wildly under-identifying youth with disabilities. And as a result, these youth do not receive the educational services to which they're entitled. So why is this happening and what can be done about it? First off, there's a maelstrom of agencies that should be working together to identify and provide educational services to youth with disabilities. But the current reality is that the system does not work and there's no accountability for the fact that it does not work. DESE, the Department of Elementary and Secondary Education's delegation of the identification of youth with IEPs to both houses of correction and to DOC and to school districts for the payment of many of these services leaves no single agency sufficiently accountable for actually delivering the services and or for being accountable when it doesn't happen. For youth within House of Correction, the law is unambiguous. DESE has the obligation to provide special education services to those with an IEP under Chapter 71, Section 11A. However, A major problem, again, is that DESE has delegated this responsibility to identify youth with an IEP to both the House of Corrections and to DOC. For DOC, there's an MOU in place that specifically says it's DOC's job to identify youth with IEP. And for House of Corrections, they have a practice manual that says broadly the same thing. But we've seen at the House of Corrections wild differences in identification practices between facilities. And our estimates show that the House of Corrections are failing to identify more than 170 youth with IEPs per year. And as mentioned at the DOC, there's simply no meaningful process to identify youth with IEPs. Remember, only 2 youth received received special education services in more than 2.5 years. Even for those youth at House of Corrections who do manage to receive special education services, what they get actually is limited to tutoring in math and English only, and most receive no credit towards the completion of their high school diploma. The Collaborative for Educational Services, CES, which is the service provider contracted by DESE and their SEIS unit, the Special Education for Institutionalized Settings, is more worried generally about contract compliance than actually meeting the needs of the youth in their care. So in sum, there's just a lack of accountability between DESE, DOC, the Houses of Corrections, school districts, and the service provider. So what might be some solutions here? To end this testimony on a more positive note, we have an in-state model on how to do this better. For youth detained or committed to the Department of Youth Services, again, 51% of those youth are identified as having an IEP in place and are receiving some special educational services. This is in part because DYS and DESE have a data sharing MOU in place that enables DYS to know within a few days of a youth's arrival whether they have an IEP in place and to contact school districts to receive proper documentation. More broadly, DYS operates on a positive youth development framework for which education is a core component, and all youth in their care, including youth age 18 to 20 in DYS care, are in school 5.5 hours a day. The following solutions could help this address some of the challenges. First, prioritize education for all young people incarcerated at House of Corrections and DOC, age 18 to 24, regardless of placement, regardless of classification, and regardless of discipline status, as just discussed. The assumption here is that young people should be in school at least 5.5 hours a day. Second, you can easily improve the identification of incarcerated youth who have IEPs through an improved data sharing agreements between DESE and DOC, as well as DESE and the Houses of Corrections. There can be a maximization of good time credit for those enrolled in educational programming, including special educational programming, and ensuring that high school credit towards graduation is possible for youth at DOC and HOCs. And finally, the expansion of college and prison options, as outlined in the recent Boston Foundation report, can also help expand on these options. Some say that systems do not fail people, but actually that system outcomes are a direct result of what the system is really designed to do. In this view, the failures to prioritize education within DOC and HOC are simply a reflection of systems that are designed for punishment, not rehabilitation. In the case of youth with disabilities, age 18 to 21, at DOC and most HOCs, the carceral instinct, bureaucratic complexity allow for educational rights to be disregarded with no one being accountable. Thank you.
Thank you very much, Mr. Dankoff, and thank you for the written testimony you provided us as well. And I strongly encourage everyone to read that report by Citizens for Juvenile Justice, which I've had a chance to review. Just a few questions from me. The first is talking about the partnership that exists between DESE and DYS right now. So, bit of a leading question, but I assume that that's related to the effort by Citizens for Juvenile Justice for the Raise the Age bill.
Well, we are certainly encouraged by the work at DYS and think that as a harm reduction method, including 18 to 20-year-olds in the juvenile court, would address many of these questions. That would mean that all 18 to 20-year-olds who would be incarcerated would not have to deal with the House of Corrections, would not have to deal with the Department of Correction, and would, if it was decided by the judiciary that they needed to be confined, would be a DYS facility. It's really a quite striking difference in system orientation. To just provide one other example in reference to the discussion of solitary confinement, at Department of Youth Services, the average time that a young person may be disciplined for is 45 minutes. They're going to have a chance to cool down, and then they're going to be engaged, further engaged in programming. That's a stark contrast to the 22 hours, 21 hours that's being discussed.
Thank you. You had focused earlier on the House of Corrections and how few incarcerated people in the House of Corrections receive special education services. I'm wondering if are there any sheriffs that have particular staff persons or a department that is focused on special education for its incarcerated members?
Each of the House of Corrections have an education director, and some of them have teachers in-house. The special education services would be separate from that and are supposed to be provided by this DESE contract. And the contract, the service provider is CES. So in a few of the House of Corrections, there will be a special education teacher coming around and actually providing those services. But they can't do that unless the House of Corrections identifies students. And so, and some of the whole contract is based on the number of teachers is based on the number of students that have been identified in the past. So you have in some House of Correction, 0.2 FTE, someone coming 1 day a week to provide special education services. There's no way to meaningfully provide special education services in line with the young person's IEP if they're just showing up 1 day a week.
And can you provide us a list with those House of Corrections that do have a staff person assigned to that?
Certainly. That DESE has provided in response to a public records request that information I will gladly share with the committee. There are some that we've looked at the past several years. I mentioned Norfolk, but there are others that have been consistently low. In the document I just shared, you can see in the very colorful charts, the ones that have a very low or no red line means they're really under-identifying the number of young people as opposed to what you would expect based on the populations there.
Thank you. And the first part of today's hearing was around data. And I'm just wondering if Citizens for Juvenile Justice can comment on the data systems of the DOC as it relates to helping juveniles or education. Sort of a broad question, but.
Sure. Even to figure out the data that is available has improved slightly, publicly available has improved slightly with some Tableau dashboards, but even to parse out how many 18 to 21-year-olds are at DOC or House of Correction is not possible. You can look in broader 18 to 24 tranches. And in terms of education, there are data from the DOC that suggests that only about 1/2 of those in their custody have a high school degree or a high set. So the need is absolutely there for educational services. But down to a detailed level, no, we do not have great data. To talk about the 2018 legislation, the legislation did create on the juvenile side the Juvenile Justice Policy and Data Board, chaired by the Office of the Child Advocate, and their data, their work collecting data and providing that, analyzing and providing publicly has absolutely enhanced our understanding of what's happening on the juvenile side across the system, and something like that is not yet available on the adult side.
Yeah, the Office of Child Advocates does provide incredible reports through that data board, so I appreciate you mentioning that. My last question is, you mentioned college education, and just want to highlight that there are increasing number of universities that are hungering to offer more college instruction, whether to House of Corrections or to Department of Correction facilities. And my observation is there, at least with the DOCs, there continues to be barriers set up in some cases by supervisors of specific prisons to allow for that to flourish or to happen.
Yeah, there's not a specific question there, but I would agree. And I think that there are opportunities with the next administration to really expand access to college and prison for sure.
Great. Thank you so much.
Thank you.
JJ, questions?
Thanks, Chair. Again, just a question from a committee member. Could you offer just a general description based on your experience and observations of the physical and mental health resources available for students currently held in the DOC? If you can.
I'm not an expert on that side. I will say that there have been a large, broadly they're insufficient. There's well-documented medical and mental health deficiencies. If you just look at the staffing, again, to contrast what's happening at DYS with what's happening at DOC. DYS, they're going to have many more clinicians per person incarcerated than what's happening at DOC and the House of Corrections. So the possibility to engage with professional staff, and again, following the positive youth development model at DYS is much stronger than at the DOC.
Thank you.
So, Mr. Dankoff, thank you very much for coming before the committee. Really appreciate the work and the written testimony and the report. Thank you very much.
Thank you so much.